Okay. Well, welcome everybody to what is now our 10th webinar for the School Health Research Network. It's the second one we've done this academic year. We noticed that quite a few of you phoned in. If you feel that it'd be useful for you to have sight of the presentation that we're going to be sharing today, you can email the Shern email address, and Gillian is able to then forward you the slides. I think whether anybody's been having problems with IT, because we had more people signed up than have joined us, I'm not sure, but please do that, and then you can follow the slides with us. So welcome. It's lovely to be offering you another very pertinent webinar, and using the Shern data based on the data that you've provided from schools, and this time we've done all sorts of different topics, and all of those webinars are up on our website. But we've self-harm, we've looked at the health of looked after children and young people, and the importance of eating breakfast, and any of those you can go on the website and watch them at your leisure. But today our attention turns to sex and relationships education, and so I'd like to just say who's joined us. So we've got obviously people from the from Network Schools, we've got some Healthy Schools staff, National Quality Award verifiers, so it's a range of different people. And just to tell you before we start what you do if you would like to ask questions or to sort of join in with the chat, is there's a question mark at the top of your screen, and if you press that, then you're able to then type a question, and you can do that at any point during the webinar, and then I will pick those questions and can ask them on your behalf. So I am going to I'm very excited to introduce to you Honor. Honor has Dr. Honor Young is based in Decipher, and has done some work, as I say, on sex and relationships education using the data that we have from both the school environment questionnaire and the student survey from the last round. So I'm going to pass on to Honor, who's sitting by my side, and so we can yes, if you want to move that, and then we'll. Right,
there we go.
Keep going. Yeah, there we are.
Great. Is that okay? Thanks, Joan. Yeah. So thanks very much. So my presentation today is looking at school practices and exploring how important they are for young people's sexual health. So just to give you an overview of the aim of the presentation, it's really just to provide a bit of an overview about what is already known about school practices in relation to young people's sexual health outcomes, to share with you how we analyse some of the School Health Research Network Shern data to investigate how school practices relate to student sexual health outcomes for pupils in Wales. And then finally, to discuss the implications for our findings, so for you to think about what this means for you and your school. So just to give you a bit of an overview, I'm sure you're all very familiar, but so the School Health Research Network is some technical issues. So the School Health Research Network is a network of secondary schools in Wales. They've all joined together to work with researchers, Welsh Government and other organisations to support young people's health. And the aim of the network is really to help improve health and well-being. So the network helps schools in Wales to work with the researchers and to generate and use good quality evidence to help inform their health improvement. So thank you all. I'm sure you're all part of the network.
Yes, I'll echo that.
Thanks. So just to move on then and think about why we are specifically focused on sexual health. So adolescence is a really critical time period for young people. It's a time when they're establishing norms around sexual activity. And there's research that suggests that young people who engage in early sexual initiation, inconsistent condom use, and those who have multiple sexual partners are at risk of transmitting and contracting sexually transmitted infections or STIs, and also experiencing unplanned pregnancies. And what we also know from UK and international data is that many young people leave compulsory education having engaged in sexual intercourse, so they've had sex, and also they've engaged in risky sexual behaviour, and this might be something like non-condom use. And we'll talk about the figures that we have for Wales in a few slides' time. So I think it's thinking about why this is important. So it's important not only for the sexual, physical, and sort of emotional health for young people, but it's also important thinking about wider costs, sort of NHS and sort of wider public health services. So it's important that we promote safe sex and healthy relationships and sort of positive sexual behaviour for young people. So why then are we focusing on schools in particular? Well, schools play a really important role in students' sexual health and well-being, and this is primarily in relation to sex and relationship education. So there's nationally representative data from the British National Survey of Sexual Attitudes and Lifestyles, NATSAL, so it's a bit of a name, but that's looked at how school-based sex and relationship education, or SRE, has been linked with better sexual health outcomes. And that includes remaining sexually inactive, having a later age of sort of sexual debut, so the first time that young people have sex, and also condom use. So there's evidence to suggest that sort of having sex and relationship education, especially that received in school, is sort of associated with positive sexual health outcomes. But what we do know is that sex and relationship education, certainly across Wales, and we also know it's evident from evidence across the UK and also internationally, that sex and relationship education in school varies quite considerably. And the Estin 2017 review, I think, kind of demonstrates that. And we also know from international data and evidence that students and teachers report a sort of dislike of teachers delivering SRE. For students, they tend to say that they find it a bit embarrassing, that sometimes there's that sort of blurred boundaries between teachers. They feel that there's a bit of a power imbalance, and perhaps that teachers maybe experience poor training, which makes it difficult for them to deliver. And we hear teachers saying similar things, that they typically feel uncomfortable discussing sexual issues. So there's a general feel perhaps from students and teachers that they're not so fond of teachers delivering SRE in schools. And then the final point about why we're focused on schools is it's not just about the education that students receive. It's actually also more of a whole school approach about contraception availability, and that also playing a key factor for improving students' sexual health outcomes and preventing teenage conceptions. And actually provision of contraception on school sites is a recommendation from the NICE guidelines, so the National Institute of Clinical Excellence. So that's why we're focused on sexual health, and that's also why we've got a specific focus on schools and the roles that you play. So thinking about the piece of research that we have conducted, what was it that we particularly wanted to find out? So based on all that existing evidence that is out there about sexual health and also about the role that schools play, what we were particularly interested in finding out was how the delivery of SRE by teachers compared to other forms of delivery was associated with better sexual health outcomes for students. So is the delivery of SRE by someone other than a teacher associated with sort of better sexual health outcomes for students? We were also interested in whether the provision of an on-site sexual health service was associated with better sexual health outcomes. And then finally, whether the provision of free condoms on the school site was also associated with better sexual health outcomes. So we were interested in the mode of delivery, so who was delivering SRE, whether the school has an on-site provision of sexual health services, and also whether the school had free condom provision, and how those relate to students' sexual health outcomes. So I'll move on to talk a little bit about what we measured. So if you've taken part in the Shern survey, these questions might be familiar to you if you've had a look at the student questionnaire. So we measured 3 questions that looked at students' sexual health. So just to put a bit of a disclaimer, there's some orange text at the bottom of the screen which says students were only asked these questions if they were aged 15 years or older. So we don't ask these questions to students who are younger than that age. And also students are able to respond that they don't want to answer. So they can always leave the question blank, but they also can, specifically say that they don't want to answer. So we asked students 3 questions about their sexual health. We asked, have you ever had sexual intercourse? Which they could say yes, no, and of course, I do not want to answer. We asked them how old were they when they had sexual intercourse for the first time, and they were given response options here to say 11 years or younger, 12 years, 13 years, and then right up to 18 years or older. And the 3rd question they were asked was about contraception use. They were asked, the last time you had sexual intercourse, did you or your partner use a condom? And they could say yes, no, or I don't know. Or also the I do not want to answer. So those what were our outcomes. That's what we were interested in, how those sexual health outcomes differed for students. And we also asked some questions about the school environment. So if any of the teachers who've joined us completed the school environment questionnaire, these questions might be familiar to you. Mm-hmm. So we asked 3 questions about SRE. We asked who has main responsibility for teaching sex and relationship education at your school. And the response options we gave here were any classroom teacher, whether it was an RE teacher, a science teacher, a form tutor, a specialist SRE or health education teacher, the school nurse, an outside agency or other. So there were several different options here, and what we were particularly interested in was whether teachers as a group differed to other forms of delivery, other modes of delivery. So what we actually did was combine the categories of classroom teacher, RE teacher, science teacher and form teacher to be grouped together to form a sort of teachers category, and those were then compared to other modes of delivery. So that was our first question. The second question then, a bit more straightforward, was does your school have an on-site drop-in service specifically for sexual health advice? And that was a yes/no answer. And does your school have on-site provision of free condoms for school students? And again, that was a yes or no answer. Okay, so I will move on. So what did we do? So we had data from a total of 3,781 students who were aged 15 to 16, who took part in the 2015-16 Student Health and Wellbeing Survey. So because the sexual health questions are only asked to those aged 15 and above, that's why we've only got these students. And these came from 59 schools who'd also taken part in the 2015-16 School Environment Questionnaire. So again, we needed students who have taken part, and we also needed sort of matched data then from the school. So thank you very much to everybody if you completed both of those. You've been a great help. Thank you. So as I said, we were particularly interested in exploring the relationship between our school level factors. So who was delivering SRE, whether the school has an on-site sexual health and advice sort of drop-in centre, and also whether the school provided on-site provision of free condoms. So we were interested in each of those 3 things and how they related to the students' sexual health outcomes. So whether they'd ever had sex, the age at which they first had sex, and also whether they used a condom at last intercourse. So what did we find out? This is the good bit. So in relation to student sexual behaviour, what we found was that 25% of 15 to 16-year-olds reported that they had ever had sex, and that the average age of first intercourse was 14.2 years. So I think although that number might sound a little bit shocking, I think it's just to be mindful that the students were only aged 15 and 16. So that the sort of oldest they could possibly be was 16 years old to report the age that they'd had sex. So that might sort of skew that number a little bit. Another finding was that 57% of those who reported having sex did not use a condom at last intercourse. So over half, and nearly 2/3, well, not nearly 2/3, but over half had not used a condom at last intercourse. So that was student sexual behaviour. If we move on then to think about the school practices, so what your schools provide, SRE was delivered by teachers, 15% of our schools said that. 22% was delivered by specialist SRE and health education teachers. 19% delivered by a school nurse. 7% was outside agencies, and then other was 37%. So again, what the other might sort of comprise of is something that we're hoping to explore in future surveys in a little bit more detail to see how varied this actually is. And again, just to remind you that when we say delivered by teachers, that was the form teacher, the RE teacher, the science teacher, or a classroom teacher. So we've grouped those together. We saw that 51% of schools had an on-site drop-in for sexual health, and 28% of schools provided free on-site condoms. Okay, so that's the sort of state of play. And next, I'll share with you what we found when we started to look at the relationship between what the schools were doing and also what our sort of students were reporting in terms of their behaviour. So thinking first of all about delivery of SRE, so who is delivering sex and relationship education and how that relates to students' sexual health outcomes. What we found was the SRE delivery mode, so who was delivering SRE, was strongly associated with positive sexual health outcomes. And what we found was that when SRE was delivered by a school nurse or a specialist SRE or health teacher, compared to a teacher, classroom sort of teacher or RE teacher, science teacher, form tutor, that grouped category, when it was delivered by a school nurse or a specialist teacher, it was associated with lower odds of sexual initiation. We also found, again, similarly, when SRE was delivered by a school nurse, that was associated with a later age of sexual initiation. So students were delaying sort of sexual debut. And then finally, when SRE was delivered again by a school nurse or an outside agency, that was associated with using a condom at last intercourse. So our sort of findings suggested that, school nurses, those specialist SRE educators or outside agencies were particularly associated with more positive sexual health outcomes for students when compared to delivery by teachers.
That's really interesting.
We'll make of that what you will, but we can discuss that in a few slides' time. So if we move on to the other sort of levels of provision in the schools, thinking about provision of on-site sexual health services, what we found was that when schools provided an on-site service, this wasn't associated with young people reporting that they'd ever had sex, nor with the age of initiation. So there was no relationship between whether the school provided a service and the age of initiation. But what we did find was that if an on-site sexual health service, having an on-site sexual health service at the school was increased the odds of young people reporting that they'd used condoms by 46%. So that was our findings about on-site sexual health services. And then moving on to the provision of free condoms on site. So there was no association here between on-site provision of condoms and experience of sexual intercourse. So students were no more likely to have had sex, whether the school provided an on-site service, condom provision, sorry. And here we also found that students at schools that provided condoms were more likely to have had sex at an older age, so they were more likely to delay sexual debut, but they were actually less likely to have used condoms the last time they'd had sex. So it's a bit of a surprising finding there, but we can explore the sort of potential reasons why that might be, perhaps in a few slides' time.
Yes,
That's
that'd be
okay.
interesting.
Okay. So I will move on now. So these are just kind of notes to consider, I think, given the the type of data that we're using. So the study included student data from 59 schools, and that's representative of secondary schools in Wales as a whole. As I mentioned before, only students aged 15 years and older were asked questions about their sexual behaviour, and they could also select "I do not want to answer" if they chose not to answer those questions. I think one of the interesting points to raise is that we didn't actually collect any data on the content of SRE or the amount of time or kind of quality of SRE that was delivered. We only actually looked here at mode of delivery. So that's something that's important and is likely to kind of play a role in perhaps sexual health outcomes as well. And then finally, the data is only collected at one time point. As you know, you've completed the questionnaires. So this only gives us a kind of cross-sectional snapshot of what's going on. So we can't really say that school practices are necessarily causing the students' sexual health outcomes, more just that they're related at this point in time. So
is that something you'd like to look into further? Is that?
Oh, absolutely. Yeah. I think that would be, really helpful to be able to look sort of, more longitudinally about these things. I think for us to help, see what the kind of causal relationships are would be really, really beneficial, certainly for young people's health. And also your school practices.
Indeed.
So just thinking about the implications now, what are the implications for you and for your school and for your young people? So the findings are suggesting that who delivers SRE in your school may be important for students' sexual health outcomes. What we found was that SRE delivery by a specialist, SRE, health education teacher, school nurses and outside agencies were linked to positive sexual health outcomes when compared to teachers delivering this. I think that it's also really important to kind of acknowledge that, as I mentioned in the previous slide, we didn't measure anything about the content of delivery. We didn't measure anything about the kind of quality or how much time was kind of delivered in relation to SRE. And we also don't know we haven't tested how pupils' outcomes might vary between teachers receiving different levels of support. So we're certainly not saying that teachers aren't doing a great job delivering SRE, because it's likely that some teachers do very well delivering SRE, but this might relate more to kind of the level of support and training perhaps that they receive. And I think also to think about how, it might be more in relation to those kind of classroom dynamics and how actually you kind of negotiate those, as well as the content. That's certainly what we know from existing literature about delivery of SRE. So just in relation to this point, thinking about the recommendations of the SRE expert panel. So this was a group of experts who were brought together to provide recommendations to the Cabinet Secretary for Education, Kirsty Williams, to provide recommendations about what the sort of next steps should be for sex and relationship education as part of the curriculum reform. And one of the key things that was mentioned there was about teachers not necessarily receiving enough training to deliver sex and relationship education. So that might be something, I don't know if you want to write a question in or a comment in, whether that's your experience or perhaps otherwise. But really, to deliver SRE, teachers need to be trained sort of sufficiently, whether it's teachers or somebody else delivering SRE. And it's likely that will point to, positive sexual health outcomes. Certainly, that's something that it looks like we've found here. And so, moving on to the last sort of implication for your school. So provision of on-site sexual health clinics and free condoms were associated with positive sexual health outcomes for young people, but were not associated with initiating sex at an early age. So I think just to go back to the point that we found where having provision of condoms on site was associated with people who were less likely to use condoms. So again, we don't know the relationships of status of young people using condoms. We don't know whether they were using sort of dual forms of contraception, perhaps using other methods of contraception, but they were reporting that they weren't using condoms. And I think it's important here to think about how we've collected the data, that it is just one kind of cross-sectional time point. So we don't necessarily know which came first. So it may be that young people aren't using condoms, but perhaps the school has implemented, having on-site provision, but we just haven't seen that shift yet. And again, Joan, that's why it'd be really useful to have sort of more longitudinal, follow-up data on that.
Yes, because it's quite interesting, isn't it? Because I suppose the other thing is that schools could have a service, and then maybe we don't know if the young people are actually accessing the service. So I suppose that whole school approach, the healthy schools approach to sort of looking at the environment, but also looking at the ethos and involving young people's voice in all elements of their school health.
And I think just in relation to that, certainly in terms of accessing free condoms, young people kind of report this paradoxical, desire that they want the service to be accessible, but they also want it to be quite anonymous. So, you want somewhere that they can go and access contraception, but they don't want to be seen doing it because it's sort of a taboo subject, and maybe we shouldn't, you're going to be judged if you're sort of caught going there. So I think it's really important, as you say, for schools to perhaps work with young people to make sure that the provision of those services are optimum for them, so that young people, that they're user friendly, that they can go and access, and that's something that we haven't measured. But again, that point about the whole school approach, it just demonstrates, looking at not only the delivery of SRE in schools, but actually the provision of those services, the importance of a whole school approach. So it's not just education, also that provision as well seems to be very important. Okay, so I think those were all of my slides, just to sort of put the acknowledgements there, and also to thank the schools for taking part and for sort of completing the surveys. We're very, very grateful, and it's really exciting to be able to share some of the findings and feed that back to you.
Well, thank you, Honor. That was really interesting, very interesting. I've got, if anybody wants to type in a question, then this is a good time to do that. But, I did sort of, we talked about that there were some elements that you felt would be exciting to research further and find out more. But just this, obviously this was from the last round of data that we collected. So it was the last round of survey. Since then we've got many more schools, and more people have done both the student survey and then the school environment questionnaire, and linking those together. So is it something that you could foresee just doing the same research again, just sort of picking out, what the situation is maybe, in the future?
I think so, I think it would be really useful. Although that data is a sort of representative sample of, schools in Wales, I think it would be really useful to sort of repeat. I think we've improved the survey, so at this time we've got more categories for you to be able to tell us a little bit more detail about what's going on in your school, which is so valuable to us to be able to start teasing apart some of the sort of explanations why there might be differences, or the kind of more nuanced details about those differences.
Oh, that's fantastic. Well, I'm aware that there's quite a few people on the phone, so you can always email any questions that you don't ask today. If you email me, and then I can, obviously pass that on to Honor. But I think that has been really interesting, and it's very, very sort of pertinent timing. I think, with with lots of sort of looking at this area, and we do have a question which flashed up on my screen and I now can't see it, so I don't know.
Oh, did
you see it?
Methods.
You saw
that?
All right,
so.
okay.
I think the question was Did you look at other contraceptive methods? Yes. So in the survey, we did ask about other contraceptive methods, and we asked about the contraceptive pill, like the birth control pill. And again, students could say yes or no, and they can also say that they do not want to answer. We also asked questions about long-acting reversible contraception, or LARCs. So those would be things like the contraceptive implant or injection, the coil. And those, we asked those questions as well. Again, students can say yes, no, or they can say that they don't want to answer, and they can also say that they don't know. And we also give a response option which says other. So if young people are using any other form of contraception, they can also write that in as well. But for this analysis, we specifically looked at condom use. Although in the future it would be really good to do more, more detailed analysis, looking at different forms of contraceptive methods, those which prevent pregnancy and those which also prevent from STIs or sort of dual use as well.
Yeah, so it's the potential is there, isn't it?
Absolutely,
and certainly, obviously, with the new curriculum, things will be changing, won't they? So it'll be good to be able to sort of pick up some of those things with schools very kindly doing both the student survey and the school environment questionnaire. So thanks, Honor. That's really helpful. I'm just going to take the opportunity. Oh no, we've got a. Really interesting. Thank you. Don't disappear, all of you. I'm just going to share just a couple of slides just about sort of network news. So if I thank you. Yes. So just some network news slides. So I thought it was useful because these slides will come to you if we just gave the hyperlink so you could go to find them. So Honor's mentioned both of these documents. So Estin did a review of healthy relationships education, and they sort of boiled it down to three main recommendations. So looking at the work on the guidance to provide a whole school approach to preventing violence against women, domestic abuse and sexual violence. And obviously we do have additional questions that will be in the schools, your reports. So, can certainly support that. That's why, Welsh Government are a partner, and that's why those questions are in there. And ensure that the key messages around healthy relationships are embedded in the curriculum and reinforced regularly, which obviously seems very important, and then build on the best practice, and some of that sort of relates to the this work that Honor's shared. So that link is there for you to look at. And then the other document that was mentioned was the future of the sex and relationships education curriculum in Wales, the recommendations of the expert panel, and there are 11 recommendations across 4 key areas. So I haven't sort of detailed them, but the link is at the bottom of the slide, looking at definition, status and guidance, curriculum content, pedagogy and assessment, training and standards, and research and support. So it's definitely worth having a look there. And I think Kirsty Williams did say that she would sort of respond to that. So we're that should be fairly soon. So I can certainly let people know when that happens. And then just another couple of just sort of general reminders. So I think if you didn't join the last webinar, you may not have realised we're now up to 212 member schools with all maintained mainstream secondary schools in Wales. So gives sort of potential for this sort of research to just really be sort of invaluable, really, at both, sort of getting the data, but also feeding it back to you all. And just a continuation of thanks, really, because we do realise that to do the student health and wellbeing survey, for some of you, sort of well over 1,000 young people took part. It's a lot of work, so we really appreciate it because it just really forwards what we know, the evidence on all of these school health issues. And we have data for over 110,000 students, so that's fantastic. You'll have your feedback reports ready by Easter. We're in the middle of it being the data being cleaned. And I just, to keep, I will be asking again in newsletters, but we're really interested to know how you use that report, and then obviously sharing practice at the events in June. So just keep letting us know. And then just a little reminder, and I'm sure I am talking to the completely converted who've already sent us. We have got well over, about nearly half of you have returned your school environment questionnaire. There were some issues. It's a paper copy, and I think, in terms of the post and various things, but we extended the date for returns to this coming Friday. If you still, have issues, then just get in touch and we'll make sure. But it's just one questionnaire for the school. And I think this webinar has been really clear at how having the student data and then the school environment questionnaire, particularly when we get it from both schools, we can look. But even, if you've done one, then you can still do the other, and vice versa. And I just, if you think, oh my gosh, this is a lot of questions, just to mention that we have heard that it's from schools that it's quite a useful audit tool really for what you're doing in terms of health and well-being. So that's a little fillip for you. So and then just finally some other dates for your diary for the rest of the academic year. So we have got one more webinar that we'll be doing before Easter, and we're going to have a little bit of research presented by Hannah Littlecott, again using the data, but also then looking more generally at if there are issues for the schools in terms of using the health data, looking at your reports, how you might interpret the data and how you might use it. So do join us for that. And then the summer events, it's absolutely fantastic to see everybody. I think, we did get, sort of a huge sort of over 160, 170 people between the three events last year. So I hope we can do that again. And it's all about sharing practice, networking, meeting schools in the same position as you. And I think that's just really invaluable, and it's brilliant for us to meet you and thank you in person. So that's the end of the webinar. Thank you so much. As I say, any questions, get in touch. Just to let you know, there's going to be, when you leave us, there's a very quick evaluation form, just really for ideas on how we can improve and what sort of topics you're interested in, and then also the research brief for honours research. So you'll have all the important things, and particularly what does it mean for my school, so that's, you'll have that for you to be able to read afterwards. So thank you very much, and all the best.